All right, Bill, thank you. Well, this week, IU Health announced that it is devoting $100 million to create a community impact investment fund designed to battle some of the underlying causes of Indiana's poor health outcomes. Business of Health reporter Kylie Valletta has more.
Thank you, Gary. Indiana ranks among the worst in the nation for obesity, smoking, and infant mortality. The underlying causes of these health issues can be elusive and hard to remedy, but often fall under the umbrella term social determinants of health. And that's where IU Health plans to spend the $100 million. Here to tell us more about this new investment is Dennis Murphy, President and CEO of IU Health. Thanks for coming to the show today.
Thank you so much for having me.
Absolutely. We hear a lot about social determinants of health in the health world right now, but some people may not know what that term means. Can you explain what that means?
Yeah, so there are a broad array of things that determine your health besides your behaviors and your health status. So a good example is your educational attainment level. It can be your income, and even as dramatic as where you live. So here in Indianapolis, if you live at the north end of the Monon, your life expectancy is 20 years higher than if you live at the southern end of the Monon. And a lot of that has to do with what those neighborhoods, those environments look like. And so that's really where we're trying to have an impact, is really on these things that determine your health beyond just who is your doctor, where are you getting your care.
And IU Health could have put this money toward specific conditions like infant mortality, obesity, opioid abuse. Why direct it more broadly at this broad issue of social determinants of health?
Yeah, so we've seen the research that says about 70% of your health status is determined by these social determinants of health. And we think long term, if we really want Indiana to be a healthier place and to reduce the costs of care, we've got to get upstream and start to impact some of these social determinants. And this will take a while. These are big issues, but we need to start working on them.
And you've awarded the first 4 grants: a Healthy Families program in Indianapolis, a diversion center in Bloomington for opioid abuse, a neighborhood revitalization project in Muncie, and a program focused on spiritual care for socially isolated people with chronic health issues. We can't talk about all of them. We don't have the time, but is there one or two you'd like to highlight?
Well, maybe that last one you mentioned. Our congregational partnerships, as I think about them, are really trying to do 2 things. One is take people who are socially isolated, because there's a lot of data that says those folks are some of the folks who really have bad health outcomes, and figuring out how do we engage with them and really make sure that they're getting the kind of care that they need. And we don't believe we can do that ourselves. So we think working through a whole set of congregations, and we're pretty ecumenical, we want everybody to be involved. And that kind of partnership will actually give us an entree to seeing those patients and working with those people to get better health care.
And this particular investment is new, but this is not a new effort at IU Health.
Yeah, you know, I go back to our founding over 100 years ago. We're a charitable organization, and we believe that our job is to improve the health of the communities we're in. And so this is really just a supplement. Today we provide over $700 million worth of community benefit, and that's charity care and a series of other community programs and helping Medicaid patients. This is really, again, an add-on to that to get upstream on some of these bigger health issues.
And only a few seconds left, but this, you mentioned, is ongoing, long-term. These things take time to change.
Yeah. Well, you know, we didn't get this way in a year, but I do believe this is the start of a very long-term commitment to have the impact we want on these kinds of issues, and you have to start somewhere. So this is our first major foray into this, but it won't be our last.
All right, Dennis, thanks so much for coming to the show, and we're excited to watch this fund grow and see what it does.
Well, thank you so much.
Gary, back to you.